So the mental health policy, as mentioned, has been approved. It's there. It was a fantastic piece of work by the Ministry of Health, and they sought our consultation. And it's published. So the mental health policy for the UAE is there and available. The Mental Health Act has been written. It's been reviewed. But it's now out of our hands in DHA. It's moved on to the legislators, so it will be for them to approve it, inshallah. In terms of the early intervention can have two meanings, as Farah explained. On the one hand, early intervention meaning detecting the mental illness early before people become too unwell. It's easier to treat. But there's also early intervention from a developmental perspective. I'm a child psychiatrist, so I'm particularly passionate in development and those early years, and it really is the time to intervene. If we can set a secure base for infants and children in the first 5 years of their life, the sort of benefits will be long lasting. We know that children who have a secure attachment, that have had a solid basis, these children later, 20, 25 years later, are more likely to be in work, to be married, to have families, to be less likely to suffer from mental health illnesses, less likely to be using drugs or other substances. So it's really the time to invest. So that's something that Dr. Azhar in Latifa Hospital will be spearheading, the infant mental health. So with babies and young children, sometimes the presentations can be a little bit, they're not so straightforward. The baby doesn't come to you saying, I'm feeling depressed or anxious. But babies and children come as part of a system, whether it's some kind of carer or family. So you want to really take a bit more of a holistic or systemic approach. So you'd be doing a bit of detective work to find out, even simple things like, is the baby sleeping, eating, engaging, smiling? And you can start, are they developing, are they meeting their normal milestones, are they doing the things they should be doing during those first 5 years? And so that's with the little ones. And actually, as you sort of gain an eye, I suppose, in a way, and that's where the mental health training comes in, more people would be able to pick up in terms of, okay, these babies look happy and they're developing normally, but these are the ones that we need to maybe have a think about what we can be doing to support them and the carers around them. Those early years can be very stressful for families, looking after a baby. I think there's a saying that each baby needs a village to bring it up. Yeah, there's a saying like that. And I think now we're living in a time where those family structures are not the same. Especially, I think it's a challenge in Dubai. You have a lot of expat families that, it's a working father, maybe a working mother, and children, and they don't have much to support them. And I think that puts a lot of strain. So that's early intervention with the little ones. With the older children and adults, when does something become a mental illness? We used as a definition in the strategy, we used the WHO definition, which is not just an absence of illness. It's when there's a sense of, that you're not feeling satisfied with your life, that you're not feeling, it's normal to get anxious, to get stressed, to have ups and downs. That's part of life. But when is it actually starting to really affect your sense of well-being? And then the most critical thing really for diagnosis is it impacting your function? Is it impacting on the relationships with people around you? Is it affecting your job and your ability to perform? That's when you start to say, okay, this is the point that we need to take some action. So at this very moment, we're in the final stages. Inshallah, we'll get the approval for 2 key training programs. The first one is for infant mental health, which will be about training up staff throughout the private and public sector in detecting, in knowing what infant mental health is so that they can detect problems early. And then a second training program, which is a WHO program to train up primary healthcare workers. So people in the community, and they could be, again, private or public sector. It will be open to all primary healthcare workers, community, family physicians, nurses, to help them detect and even, more excitingly, even to also manage some of the simple cases so that they can stay in the community and don't need the more costly, stigmatizing hospital care.